Hi, now I'm going to be performing the urinary catheter insertion. Okay, so I'm going to start. So I'm going to check the email. I'm going to check for my patient's order. And I'm going to check if my patient is allergic to latex, betadine, or adhesive. And I'm also going to check the last time my patient voided. After checking all that, then I'm going to go get my supplies, space, and I'm going to get an assistant if I need one, or I don't. So now I'm going to my patient's room. Not now. Oh, good morning. How are you this morning? Yeah. I'm going to provide privacy. Look at my hand hygiene. Good morning. My name is Lola. I'm going to be your student nurse today. How are you feeling this morning? Please, can you tell me your name and date of birth? And I'm going to be checking the patient's ID band. My name is Miss Gloria, and my date of birth is August 20, 1982. Okay, good morning, Miss Gloria. Are you having any pains this morning? Okay, then. Do you have any allergies? I'm checking the allergy band. No. Okay, Miss Gloria. So this morning you have an order for a urinary catheter insertion, and you're having that because you're going in for a C-section soon. Okay. Okay, then, Miss Gloria. So I'm going to raise your bed up now. Okay. So I'm going to raise patient's bed up to a comfortable working position. And I'm going to adjust the light source so I can see properly. Okay, Miss Gloria, so I'm going to be placing your leg. This position is called dorsal recumbent position, okay, because of the catheter that I want to insert, okay? Okay then. So I'm going to place patient's leg in a dorsal recumbent position, this way. So then the CNA already provided perineal care for the patient, so I don't have to do that again. Okay then. So now I'm going to get my supplies ready. I'm going to remove the sterile tray. And I'm going to place it between patient's leg. This way. I want to use this as my trash bag. Okay then. So now I'm going to open the wrapper. The side already opened itself. Maintaining, using the sterile technique. I'm going to use the sterile technique. With the last point going towards my patients. Okay then, yeah. So now I'm going to get the other bottom wrapper. So I'm going to place this underneath the patient carefully, using the sterile technique. Okay, Miss Gloria, please can you make a bridge for me so I can put this underneath you? Okay, now I'm gonna get my gloves, sterile gloves. Yeah. So using the sterile technique, I'm going to sterile. I'm gonna open my gloves, put it up. Okay. Okay. Okay, and this is just for demonstration purposes, but if it's on normal, the table has to be the waist length. Okay. Okay then. So now I'm not going to use this, so I'm going to toss it in the trash. Get everything. And so this is my betadine. I'm going to open it up. I'm going to pour it on the cotton bud here so it gets saturated. Put this in the trash. Okay. And this is my lubricant. I'm going to open it. Pour it in the tray. Just get this in the trash. Then this is my pre-filled syringe. I'm going to attach this to the catheter. I'll open this in. I'm going to attach it to the pot. Okay. So according to the manufacturer's policy or the hospital policy, I'm going to test this balloon to make sure the balloon is working properly, and to also make sure that there's it's not leaking. I'm going to discard this. I'm going to inflate the balloon to check. See, I'll wait for some, see if it's okay. It's working, it's not working. So I'm going to leave the syringe, the pre-filled syringe attached to the catheter, and I'm also going to pay attention to the amount, which is 10 cc's, 10 mils. Okay. Okay, now, so I'm going to contaminate one of my hands. I'm going to use it to separate the labia, the patient. I'm going to be cleaning you up now, okay? Okay. I'm going to separate the labia. Then I'm going to take the tweezers, and I'll take one unsaturated wool, and I'm going to clean the patient from the clitoris, one part from the mentus, from the clitoris down to the anus. So I'm going to clean this part from up down. I'm going to discard it. I'm going to take another one. Clean the other side of the mentus from the clitoris down to the anus. I'm going to discard it. Now I'm going to take the third wool. I'm going to clean the middle from the clitoris down to the anus. Okay, I'm going to discard this. So while still holding the labia separate, I'm going to get the catheter, the catheter tip, and I'm going to insert 2 inches. I'm going to lubricate it with the lubricant. Okay, good. And I'm going to hold it 2 to 3 inches. Okay, Miss Gloria, I'm going to insert the catheter now. So you can bear down while I'm inserting it, okay? So I'm going to do it now, and I'm going to insert it into the mentus carefully, okay, or gently. So I'm inserting it. Okay, gently to the mentus, and I'm going to watch for a flash of urine. So when I see a flash of urine, that means that the catheter is in the bladder. Are you having any pain? No. Okay then. So I'm putting it in. Okay. While holding the tube open. Okay. So now I can see a flash of urine. Okay then. Good. So I'm gonna let go of the labia and use my contaminated hands to stabilize the catheter. No, sorry. When I see a flash of urine, I'm going to insert 2 or 3 more inches more to make sure that the balloon is well in the bladder. Okay. Okay, that's good. So now I'm going to use my contaminated hand to stabilize the catheter, and I'm going to inflate the balloon. Okay, and I'm gonna inject all the content, the entire content, in the pre-filled syringe into the balloon. And if the patient complains of any pain while I'm doing this, I'm going to deflate the balloon and advance 2 to 3 more inches or a little bit more. Then I'm going to re-inflate it back. Okay. Are you having any pain? No. Okay then. So while holding onto the plunger, I'm going to disconnect the syringe. Okay. Good. So now that I'm done, I'm going to provide perineum care for the patients. Are you okay? Yes. Okay. Then I'm going to discard all my used supplies. I'm going to discard everything in the trash. Everything in the trash. Okay, then I'm going to also take off my soiled gloves. Don't do my hand hygiene. Okay, then. I'm going to put on another set of gloves. Okay, so now I'm going to secure the collection tubing to my patient's legs. Then I'm going to attach the drainage bag to the bed frame. Okay. And I'll always make sure that the drainage bag is not placed above or raised above the bladder. Okay. You're doing good? Yes. Okay. That's good. Do you need me to do any other thing for you? No? Okay. So I'm going to adjust my patient, cover off properly. Okay. I'm going to put patient's bed in the lowest position. I'm going to put our core light within reach. Okay. Are you having any pain? You good? Yes. Okay then. So I'll be back to check on you. Okay? Okay. I'm going to take off my gloves in the trash, do my hand hygiene. Okay, see you soon, okay? Okay, bye. So I'm going to go out of the room and I'm going to go document according to hospital policy. I'm going to document the urine contents, the catheter size, and the amount in the balloon.